Anxiety disorders can be influenced by a variety of factors, including a combination of genetic, environmental, and psychological factors. While it's important to note that the presence of these risk factors does not guarantee the development of anxiety, they can increase the likelihood. Here are some common risk factors associated with anxiety. Family history and genetics. Individuals with a family history of anxiety disorders are more likely to develop anxiety themselves. Genetic factors can contribute to the development of anxiety disorders, although the specific genes involved are not yet fully understood. Traumatic experiences. Experiencing traumatic events, such as physical or emotional abuse, neglect, accidents, or witnessing violence, can increase the risk of developing anxiety disorders. Trauma can have a lasting impact on an individual's mental health. Childhood development. Certain aspects of early development can contribute to the risk of anxiety disorders. These include inconsistent parenting, excessive criticism, overprotectiveness, or a lack of support and nurturing. Additionally, children who are shy, inhibited, or prone to excessive worrying from an early age may be more susceptible to anxiety disorders. Chronic medical conditions. People with chronic physical illnesses or conditions, such as heart disease, diabetes, respiratory disorders, or chronic pain, may have an increased risk of developing anxiety. The challenges associated with managing a chronic condition can contribute to feelings of anxiety and distress. Substance abuse. Substance abuse, including alcohol, drugs, and certain medications, can increase the risk of anxiety disorders. Substance use may initially provide temporary relief from anxiety symptoms, but it can lead to a cycle of dependency and worsening anxiety over time. Personality traits. Certain personality traits can predispose individuals to anxiety disorders. For example, people who are perfectionistic, excessively self-critical, or have low self-esteem may be more vulnerable to developing anxiety. Brain chemistry and imbalances. Neurotransmitters, which are chemicals in the brain that regulate mood and stress responses, may play a role in anxiety disorders. Imbalances in neurotransmitters like serotonin, norepinephrine, and gamma-aminobutyric acid, GABA, have been associated with anxiety. Stressful life events. Significant life events such as divorce, job loss, financial difficulties, moving, or the death of a loved one can trigger or exacerbate anxiety symptoms. Prolonged periods of stress can contribute to the development of anxiety disorders. It's important to remember that these risk factors are not definitive predictors, and individuals may develop anxiety disorders even in the absence of these factors. Anxiety disorders are complex conditions, and a comprehensive assessment by a healthcare professional is necessary for an accurate diagnosis and appropriate treatment.